Well, both nursing home staff and workers were also part of the state's Phase 1A vaccine rollout plan. So when you saw hospital workers getting injected with the vaccine yesterday, many people thought nursing home workers would too. Despite being part of the same phase, the hospitals and long-term care facilities are part of two different vaccine distribution timelines. Hospitals first.
Soon thereafter to work in the long-term care facilities.
Pfizer's shipments went directly to the hospitals, which also serve as distribution hubs for the vaccine across the state. The long-term care industry is getting their vaccine from the retail pharmacies, CVS and Walgreens, as part of a federally coordinated vaccine partnership program. The pharmacies will begin nationwide vaccinations on Monday, but a handful of Connecticut nursing homes could get the vaccine as soon as Friday.
This allows all of the nursing homes to quickly receive the vaccine, all of the residents to be vaccinated, all of the staff to be vaccinated very efficiently and effectively.
The logistics are challenging: cold storage, transportation, and dosing 3 weeks apart. But then there's the issue of consent. The CDC says verbal consent is enough, while the pharmacies continue to ask for written consent, a challenging hurdle for residents with dementia or whose family is hard to contact.
We originally were told we needed to provide certain written consent forms, but CDC has clarified that that a verbal consent would be permitted, particularly from residents and staff. And so we're just working with the pharmacies right now to straighten that out.
With hope just days away, pressing questions still remain, like what will the vaccine mean for visitation? Could residents and family members who receive the shot be allowed to have an in-person visit for reasons other than compassionate care?
Talking with CMS about what to expect regarding visitation. There is no clear understanding at this point if there'll be any changes. We're asking for more information related to that because I think that's the most important thing to residents and family members.
Matt, it feels like up until now we've been walking into the forest, and the vaccines feel like we're beginning to walk out of the forest. But this is not a light switch that you're going to turn on. It's going to be a dimmer switch that you slowly turn up.
Yeah, and we've been told that Cherrybrook Healthcare right here in Canton will be one of the first nursing homes in the state to receive these vaccines. Even though it's just a week behind when hospitals are receiving the vaccine, another 70 residents died and more than 450 have been infected with COVID-19 in just the last week. So time is of the essence. We are live in Canton. Matt Caron, Fox 61 News.